Hi again, and welcome back to Protect, Prevent, Preserve Your Eyes. Once again, my name is Elizabeth Nystrom, a Master of Public Health student at Michigan State University, and this is Olivia Moni, a Public Relations student at Baylor University.
We will be your guides for this educational podcast, which will look at various eye conditions, risk factors for developing these conditions, and what you can do to aid in preventing some of these conditions.
We both work for Association for the Blind and Visually Impaired, a nonprofit organization focused on helping those with vision loss thrive in a sighted world. More background information on ABVI, the services offered, and ways to donate or get involved can be found on the website, abvimichigan.org.
For today's episode, we will be discussing how the various forms of diabetes can affect eye health. We'll also provide some basic background information on diabetes as well to help set up the stage. Finally, we will welcome our first guest speaker, Liz, one of our resident occupational therapy interns, for a little Q&A session. Diabetes is a disease that is characterized by higher than normal blood sugar, also known as glucose, levels. Blood sugar rises and falls in relation to what we eat or don't eat. For instance, if you eat a donut, your blood sugar will rise much higher than if you eat a meat stick. There are two main forms of diabetes, type 1 and type 2. Blood sugar levels are maintained by insulin, which helps your cells take up the glucose from foods that you eat and turn this into energy.
Type 1 diabetics have a condition in which their body does not make insulin. Without enough insulin, all the sugar that you eat just stays in your blood, and your body cannot use it for energy. Therefore, type 1 diabetics must take insulin to replace the insulin they lack. Type 1 diabetes is also known as juvenile diabetes because it typically begins during childhood and is mostly genetic.
Type 2 diabetes is sort of similar in the sense that your body will not make insulin very well, or it may make insulin just fine, but be unable to use the insulin. This is called insulin resistance. Too much glucose in your blood sugar can cause serious health problems, including damage to the blood vessels, damage to nerves, leading to chronic nerve pain, heart damage, kidney damage, and damage to the eyes. We mentioned that the primary risk factor for type 1 diabetes is genetics, but risk factors for type 2 diabetes include obesity, age, family history, smoking, and alcohol use. The single most important thing that you can do to treat or prevent diabetes is to maintain healthy blood sugar levels, and this can be obtained through a healthy diet and exercise.
Many people may not think of diabetes affecting their eye health, but diabetes should be recognized as a huge risk factor when it comes to the health of one's eyes.
In developed countries, such as the United States, diabetic retinopathy is the leading cause of preventable vision loss and blindness among the working age population. The World Health Organization estimates that by the year 2030, the total number of individuals with diabetes will double what it was in the year 2000.
With this increasing population of diabetics, there will likewise be an increase in the number of diabetes-related diseases, including eye conditions such as diabetic macular edema, severe non-proliferative diabetic retinopathy, and proliferative diabetic retinopathy. The incidence of these conditions is expected to rise exponentially by the year 2030. For reference, incidence is a public health measure of the number of new cases of disease as it relates to the total population.
We'll begin with diabetic retinopathy. If you were with us last week, we provided more detailed background information on this condition, but we'll mention it again briefly in case you missed it. In short, diabetic retinopathy has two forms, proliferative and non-proliferative. This condition causes damage to the blood vessels in the retina, causing them to leak and create scarring of the retina, and eventual blindness can occur.
Diabetic retinopathy has been found to be more common among type 1 diabetics than among type 2 diabetics. Studies have shown that for type 1 diabetics, tight control of blood sugars can be associated with a reduction in the risk for developing diabetic retinopathy by about 76%, and it can reduce progression of the disease by about 54%. If you recall, the non-proliferative form of diabetic retinopathy can progress into the proliferative form, which is associated with vision loss. So this is what we're referring to here. And for type 2 diabetics, tight control of blood sugar has been shown to be associated with a reduction in the risk for developing diabetic retinopathy by about 25%.
Additionally, studies have shown that proliferative diabetic retinopathy can be prevented for up to 20 years among type 1 diabetics who keep their hemoglobin A1C below 7.6%. For those of you who may not know, a hemoglobin A1C is a measure of average blood sugar levels over a 3-month period, and this is measured by a simple blood test.
In addition to diabetic retinopathy, other eye conditions can result because of poorly managed diabetes, including corneal dysfunction, cataracts, glaucoma, ischemic optic neuropathy, and diabetic macular edema. Now, I know there were a lot of new and unfamiliar terms just thrown out, but don't worry, we'll elaborate and clarify.
Let's begin with the ones that we've talked about beforehand, cataracts and glaucoma. For glaucoma, the literature is conflicted on whether either form of diabetes is associated with an increased risk of developing this condition. Some studies have found an association, while some have not. While for cataracts, the link between diabetes and cataract development is high blood sugar.
Like diabetes, cataracts can result from unmanaged blood sugar levels. Cataracts form because of high sugar levels inside the aqueous humor in the eye. The aqueous humor is essentially the fluid inside your eyeball, between the lens of the eye and the cornea. It functions to supply nutrients and oxygen to the lens. When blood sugar levels rise, the lens swells, resulting in blurred vision. If you recall from our last episode, the only treatment for cataracts is surgical removal.
Corneal dysfunction encompasses multiple conditions that affect the cornea because of poorly managed diabetes. Roughly 70% of diabetics suffer from some sort of corneal complication. These complications include recurrent erosions, delayed wound healing, ulcers, and edema. This means that if the eye suffers an injury, it takes much longer to heal, and scarring of the cornea is possible. Similar to cataracts, corneal scarring is treated primarily with surgery.
Ischemic optic neuropathy is another condition that can be associated with diabetes. This condition is characterized by blockage of the blood supply to the optic nerve, which can lead to impaired function and vision loss. There are two forms, non-arteritic and arteritic. The non-arteritic form of ischemic optic neuropathy occurs more often. In addition to diabetes, risk factors for this condition include age, high blood pressure, and smoking. The arteritic form of ischemic optic neuropathy is more common among older adults, as in age 70 and older. Vision loss associated with this condition is very rapid, occurring over minutes to sometimes days, and it can involve one or both eyes. There is no treatment for this condition. However, about 40% of individuals who suffer from the non-arteritic form do spontaneously regain some vision.
Much like diabetic retinopathy, diabetic macular edema involves damage to the tiny blood vessels in the retina because of high blood sugar. In order to develop this condition, you must first have diabetic retinopathy, which was previously discussed. Diabetic retinopathy damages the vessels, and diabetic macular edema occurs when the vessels swell and leak fluid and blood into the retina. This causes swelling of the central part of the retina, which is associated with detailed vision loss and blindness. The primary method of treatment for this condition involves laser surgery. We will now shift into the Q&A portion of our podcast. For this segment, we will be asking Liz, ABVI's occupational therapy intern, some very common and interesting questions regarding diabetes and diabetic eye conditions. Liz, welcome to the Triple P podcast. We are so happy to have you for this episode. Would you care to introduce yourself and let us know a little bit about you?
Yeah, so I'm Liz. I'm an occupational therapy student at the University of Alabama at Birmingham, which is in Birmingham, Alabama. I'm originally from the east side of the state, so just 2 hours east of Grand Rapids, so I was excited to be here for the summer in Michigan.
Welcome. We'll start off easy. Why did you choose to go into occupational therapy?
I knew that I wanted to help people in a tangible way, kind of dabbled in a bunch of different ideas, whether psychology and going into clinical counseling or art therapy. Kind of stumbled across occupational therapy when I was a junior in college. Ended up realizing that that was kind of a perfect blend of all the things that I was interested in and wanted to do, and figured out, okay, if I just get these prereqs, I'll be set and can go and get that, and have not regretted it since.
That is really cool.
So what are the ranges of diabetic retinopathy that you have seen as an intern so far?
So far, we've seen quite a bit of ranges, but typically it depends more on the client's like their blood levels of the day, like blood glucose levels. So sometimes if we show up at 1 o'clock and they haven't had their lunch yet, they could be really low, and so that really impacts their vision for the day. So it's a fluctuating disease, and so if they are not controlling that, then their vision can be really off. So it's really a self-reported thing where they're like, man, I'm having a really bad vision day, but then they'll also report, all I've had was like pineapple juice for the day, or I've eaten nothing and I'm really hungry and I'm tired, and so just encouraging them, okay, get a bite to eat and take care of yourself, and then normally like that helps.
Yeah. So are there any common misconceptions that you hear from patients about diabetic retinopathy?
I think from the clients themselves, they have a good understanding just because at this point they've had the disease for a while. And so I personally have not dealt with many clients who don't understand what is going on other than just educating them, okay, you need to eat something. Or some days they might say, well, I can't really see what, like the television or something. And so it's like, well, if you pull down your blinds, that will help with the tint. Or, but a lot of the times they'll figure out, okay, if I just wear a hat or if I wear my sunglasses inside, their vision is helped by that.
So is there any treatment for diabetic retinopathy that you know of?
As far as treatment, it's very important to get medical attention. So if you have diabetes, to go to your ophthalmologist or optometrist on a yearly basis to get those full eye exams, make sure that that is all up to date, and that no changes have occurred. Other treatments, I would say magnification, if they need to get a new prescription in their glasses, tinting, so different colors. Sometimes they might like more of a plum color for sunglasses, or like a topaz typically has helped, but typically it's just the magnification will help. And because it fluctuates, sometimes they need stronger ones, or sometimes they might need to remove their glasses and just use the magnifier. So really it's just a hit or miss problem solving day to day with them.
So it sounds like it's very like person oriented rather than just one strict treatment that you provide for everybody.
Yes.
So with that, like which types of in-home aids do you typically provide for these diabetic individuals? Do you have any specific education that you provide them with?
Mm-hmm. So most of the time too, we have to educate them on just reading their blood glucose levels too. So if they're having a hard time reading it, the number on their actual device, getting them connected with a talking glucometer. And so that can be done through a lot of different pharmacies, whether that's like Walgreens or Rite Aid. Typically they provide those for free for visually impaired individuals. So we do that, or sometimes it's just marking on the different levels with some tape that might help them. And then the magnifier is kind of figuring out which strength they will need, and then the tints with sunglasses. So sometimes it's even just, if you wear a ball cap inside or outside as well.
So this might seem kind of silly, but can diabetic retinopathy occur in someone who does not have diabetes or maybe pre-diabetic?
The answer is no. So diabetes, to have diabetic retinopathy, you have to have diabetes. Now, the best kind of course of action would be preventing diabetes from even occurring, especially for those type 2 diabetes. So if you manage your blood pressure, blood glucose levels, have a healthy lifestyle as far as exercising, eating, healthy carbs, and lowering your sugar intake, that can help with the progression so that you're stopping diabetes or pre-diabetes from turning into diabetes. Now there is like type 1 and type 2 diabetes. Both of those diabetes can lead to diabetic retinopathy. But if you do not have either, then you don't need to be concerned about diabetes. But if you do end up having diabetes that leads to diabetic retinopathy, you're also at a higher risk for developing things like glaucoma, which is also can lead to total blindness, like diabetic retinopathy. DRs, just say.
Yeah, so that was actually a really good answer. You answered my next question, which was going to be about prevention tips. So it sounds like the best way to prevent diabetic retinopathy is to either prevent yourself from getting diabetes in the first place, or if you have that, just manage your diabetes really well.
Yes. So go to your physician, go to your ophthalmologist on a yearly basis just to track that progress if you already have diabetes. So really managing that is very, very important.
So what's the coolest or weirdest condition that you've had the opportunity to look at while being an intern?
I was reading this question earlier, and I was thinking, honestly, it's more about the people that are cooler than actually the conditions. And so some people have really cool stories, whether they have built planes and have, flown them all over, or there was one client that we had who told us about their life story of how they were in the Who's Who for an Outstanding Achievement Award. This client was at one organization for their entire career and was awarded with this like national honor thing, and we were actually there the year to the date that it was presented, so she had this whole thing and plaque and all of that, and was really proud to share all of that, and helped her to get back to reading, which was very important to her. So
that sounds really cool. I bet the best part is going out to all these people's homes, seeing where they live and how they kind of present themselves and work around their vision loss.
Yeah, you learn a lot from being in a client's home.
Yeah, I bet. So I've found that since starting work here at ABVI, I have become increasingly aware and sort of fearful of eye conditions, in the sense that I frequently think to myself, please don't lose my vision. Do you find yourself having similar fears as like an occupational therapist, or do you kind of take comfort in your practice?
No, I'm very similar to you in that I think that I have a deeper appreciation for my vision and just the independence that I have with the ability to get out on the road and drive, and just how so many of these clients that we work with are losing some of their independence and the things that they want to and need to do. So that adjustment would be very hard, and so I think that I have a deeper appreciation for that. But also I think, okay, I should probably listen to my parents of like better lighting for reading. I think that for the longest time I would sit in a dim room and read my books, and my mom and dad would always get on me of just like, you need to have more lights, and I think now I'm just like, okay, I should probably have more lights when I read. But yeah, definitely don't want to take for granted my vision.
Definitely.
Well, Liz, thank you so much for joining us today on the second episode of our podcast. It's been a pleasure to have the opportunity to interview you, and you've provided such valuable insight into some of these conditions.
Well, thank you so much.
Joining us once more today and listening to our podcast. Next week, we'll talk a little bit about how smoking impacts eye health.
As with all of our episodes, the references from this episode will be uploaded to ABVI website should any of the studies interest you. Again, I will admit though, they're quite technical in their reporting. Thanks so much for listening to the Triple P podcast. If you would like to connect with us between podcasts, make sure to follow us on Instagram and Facebook at ABVI Michigan, and make sure to join us next week. Thanks for listening to the Prevent, Protect, and Preserve podcast.